A new tool for heart health. Welcome back to Techstination. I'm Fred Fishkin. Joining us from MindMics is CEO Anna Barnacka. Hi, Anna.
Hello, it's a great pleasure and honor to be here.
Well, a pleasure to meet you. You have an interesting background as an astrophysicist with NASA and entrepreneur, diving into medicine and a new device to monitor cardiovascular health. Give us the overview, a little bit about your background and this new device.
Oh, I'm happy to, and I will try to be brief, even though the path has been taking me for a lot of different destinations and the different topics, but a little bit about myself. I grown up in Poland, where I got one of my PhDs in astronomy at the Nicolaus Copernicus Center, and simultaneously also I was getting a PhD in physics in Paris. And after my PhD, actually 11 years ago, I moved to the US to pursue my postdoc at the Harvard Smithsonian Center for Astrophysics. And this is where I've been working very hard to get an assigned fellowship, which I got. But when I got it, I felt that I've been in the state of the permanent exhaustion because I've been working so much, and I loved working and traveling because my work required a lot of traveling as well, which is not a complaint. It was a great adventure. Uh, I had to travel to operate telescopes and do a lot of incredible things during my career as an astrophysicist. But that also started to having a burden on my health. And I was in the point that I was getting this amazing fellowship that was opening a lot of doors, but I knew that if I did not slow down, I would face burnout very quickly. And that was not an option, as well as slowing down was not an option with all of the opportunities ahead of me. So I thought, since we can use science to solve mysteries of the universe, like capturing gravitational waves, understanding what's out there, we should be able to use science also to find a way to better monitor our health. So this is what I started doing. During the day, I was focusing on my research on supermassive black holes and how we can learn about them using the curvature of space-time, things we do. And then during the evenings and the weekends, nights, I started diving into medicine, how all of the medical devices work, how our body works as well, and what are we missing in terms of the monitoring, because indeed there was a lot of wearable devices, but they were not accurate enough. And the medical devices are cumbersome, and I suppose that you don't have the access to them. And I needed something that would be easy to use, part of the lifestyle, and accurate enough so it would work as a GPS for health and well-being. So that's the short story, and this is how I started MindMics. I found the technology, actually invented it. I find out that actually the ear canal works as a speaker, and it's broadcasting everything that is happening inside our body. We think about the ears as a big microphones attached to our brain, and that's true. But it's more into it because the ear canal works, the whole system works as a transducer. And what's interesting about transducers is that can work both as a microphone or a speaker. So you can actually turn every speaker into a microphone, and you can turn microphone into a speaker. And the brain is using the ear canal as a microphone. That's something that we are very aware of. But what was new was what we typed into that discovery was that actually at the same time, it does work as a speaker. We don't hear it because there is a reason why we don't hear below 20 hertz. And it's not because that there is nothing interesting to hear. It's our hearing range ends at 20 hertz because our body is so loud. We have a huge pump inside our chest that is generating a lot of vibrations, noise, sound, and there is a whole cacophony inside our body. So to not overwhelm the brain, our brain will figure it out how to filter it out so we don't hear it. But if you put the microphone inside the ear canal that's what we do, you can capture every heartbeat with the completely new accuracy, new precision.
One of the perks of working at MindMics is that I've been given the opportunity to test the early prototypes for a technology that isn't even available on the market yet. I had no idea that you could harness a sound wave that we couldn't hear through something as simple as an everyday earbud. I can be listening to my music, I can be meditating. I have my earbuds in and it's recording my heartbeats for me. I'm seeing my heart rate, I'm seeing my HRV so I can see how quickly my body's reacting and responding to things. The data that the MindMics earbuds and app give me enable me to have control. I have tangible information and data to be able to go back to the doctor instead of just saying, I'm not feeling quite right.
So with that invention, I decided to leave academia because I saw, also after talking to cardiologists, showing them the signals, they were absolutely mind blown that we can do it. And amount of information with every heartbeat, even with those first heartbeats that I was able to capture and show the cardiologist, it was clear that this technology will have so much potential from the perspective of how much information we were able to gather through the ear, how accurate the ear as a speaker is, and the fact that we can capture it through something that we wear every day, which are earbuds or AirPods and things that we put to our ears to listen to music, to listen to podcasts, to just have fun or just enjoy the noise cancellation. And simultaneously, we figured out how we can also use those systems to capture the information about our health.
So what can they capture? What can the mind mics tell us that maybe our watches aren't telling us?
That's a great question. And I will divide the answer into two parts because the one thing is about what they can tell us today and what they will be able to tell us over time. Going back to how it works, the ear itself works as a speaker and it's attached to our body, so it's broadcasting everything that is happening internally. One of the loudest systems that we are focusing on now is heart. So what we do today with MindMics, we just launched our product, limited edition, with the earbuds, with MindMics infrasonic earbuds. But what's interesting is the app that we also launched, that is taking those signals, is taking all of those those heartbeats that we can capture using the microphone inside the earbud. And what's fascinating is that our heart is the first organ that is responding to what's happening to us, to all of the stimuli around us. So everything that is stressing us out or is relaxing us, the heart will respond first because this is how our body works. This is how autonomic nervous system works. It's just adjusting all the time within the second because this is how we evolve to have that agility. And the heart does have this incredible agility. And it can be measured using parameters like heart rate variability. We all know about heart rate, and that's something that the watches are measuring pretty nicely. Because the way how watches are working and the difference with our technology is that the watches are using optical light. So if you look at the bottom of the watch, you will see blinking light. Either usually it's green, sometimes it's red, but you will see a light that is shining through the skin and can measure the blood flow just below the skin. And basically, it will see a bump each time the heart is pushing blood. And the watches can take those bumps and calculate the heart rate and get pretty good heart rate, which is okay. But the problem is that the watches, they can only see the signals very far away from the heart. So as the blood is traveling from our heart, just below the skin is losing a lot of information. So you're getting a bump, but it's losing all of those tiny changes from the heartbeat to heartbeat that we can actually infer what's happening to the cardiovascular system and looking at this agility of the heart, that variability from the heartbeat to heartbeat. So what the parameter that is very interesting in measuring that how our body is responding is that heart rate variability. And sometimes actually watches will also give you that number, but they will give you that number once per day, once per hour, but our body is responding from heartbeat to heartbeat. Now, the response of to really understand and learn how we can improve our health. And the agility of the heart is all about being able to measure it from the heartbeat to heartbeat. So this is where that precision that we get through the ear opens new applications. And what we did with MindMics, we spent a lot of time figuring out, okay, how we can bring that information, how our body is responding, how the heart is responding in real time to stressful things, to things that relax us, because it's quite amazing to see how much the change there is. So we created a dashboard, like literally, like if you want to go fast on the analogy we use to explain. To build that system was that, back in the day, people would walk everywhere. So they didn't have to measure how fast they move. There was no need for that. But once people started using cars and going to the highways, like you do need to have a dashboard that will indicate how fast you're moving. And what happened with our lives is that it speed up extremely. Amount of information, amount of work we do every day does not compare in any way and shape that to the lifestyle we had 100, 200 years ago. So our life speed up, but at the same time, we didn't have the time, ability, agility to adapt to those changes. This is why we all face so much stress, burnout, a lot of things. So with MindMics, we wanted to create a dashboard. We created a dashboard that you can see in real time what's happening, how the body is responding. Are you getting toward the fight and flight? Are you getting toward the rest and digest, and how you can get with the breath work into that equilibrium. So that's one of the first applications that we're working toward, because that's the one key aspect that we have to understand. We have to understand the response of our body, what's good for us, what's not good for us, so we can make better decisions. So this is where we are today with MindMics. So if you go to the Apple App Store and search for MindMics, our heart health system, you will be able to access our app there and look at the breath work with the devices like MindMics earbud today, but soon also other earbuds will have our technology, or the ECG strap as well, which can also connect to our system. You can see actually how the body is responding, and that's fascinating. That's something that helped me actually going back to my story as an astrophysicist. I needed the way to manage my stress. Little did I know that real stress is building a company and being an entrepreneur. So that was maybe not the best decision to avoid stress. But in life, it's not about avoiding stress. It's about learning how to deal with it so it doesn't have negative impact on our health. And to me, the whole journey through the entrepreneurship was a journey with the data I was getting through the ear, and with our amazing team at MindMics, figuring out how we can translate this data, this information, and other people can also help other people, guide them through life. So we can achieve our goals, but without facing the burnout and or other negative aspects in life. And that's where we are today. You can go to our website or Apple App Store and download our system. But that's just the beginning of what this technology can do. One of the first things we did at MindMics when we started the company in 2018, after we saw amount of information that we were able to collect through the ear, we brought a lot of cardiologists that get very interested with our technology. Especially was one cardiologist, Charles Bridges, who pointed us into a lot of interesting directions as well, and helped us to put together a few clinical studies. And then we work with the team at Scripps Health. We work at team also at Prism Health in South Carolina. And we were looking at the different aspects of cardiac health. We look at atrial fibrillation, and we show that this technology can actually do it. That was a feasibility study. It's not today yet in our product. All of those applications will take much, much more time. They all require FDA clearance, so it's much longer path than a well-being system. So today, MindMics is a well-being system, but with our R&D, we also looking at those different applications toward the cardiovascular health. So we look at atrial fibrillation. This technology was able to do it and detect it at the same sensitivity, specificity, the same accuracy that you would do with the ECG. That is a gold standard. At Scripps Health, we were comparing MindMics data, those heartbeats that we were capturing using the earbud, to the heartbeats that we detect that today cardiologists would use very invasive procedures like cardiac catheterization. So literally, they put through your wrist, through your arteries, a probe that goes to the heart, and then they can record the heartbeat, the changes in the blood pressure. So we were comparing those changes in the blood pressure in the aorta to what we see in the ear, and we saw very high correlation. So this is extremely exciting because with such a precision, completely new applications are opening. There is a hope for the preventive health maintenance for the cardiac health, where we could see actually even small changes to our heart, when we can still do quite a lot with it. And now our R&D is focusing a lot toward the blood pressure. It's a very difficult metric to measure. So now we need to collect much more data, and our team is working day and night extremely hard to see how we can extract that parameter. So the future is bright, and we'll be pushing the boundaries of what this technology can do for heart health and for the way how we age, because we need something that can help us, guide us with both accurate information, but also great user experience.
Wow. And you do have a focus on women as well, who are often underserved when it comes to heart health.
I would say we focus on everyone that needs a way to monitor their health. We do make sure that our technology is developed as good for men as for female. We pay attention to this when we're building our product to make sure that our earbuds also fit female users. Because usually when the team of engineers, if the team of engineers is male mostly, they will not even notice that, oh, maybe there are differences in the physiology. And usually when you build the first prototypes, you test it on people around you. So we made sure that women were included in those testing. We also make sure that when we're collecting the data, we have 50-50 during the training, and that's extremely important. So we make sure that it's good for everyone, and the women, and absolutely women's needs are included in designing our system. And to your point, yes, there is still a long way to go to make sure that women will get the same care, healthcare as men do. So we are very passionate about this, and it is important for us to make sure that the technology serves both.
With what you have today, can customers share their data with a physician, or is that coming in the future?
That will come in the future. Today, the customers can record the information. It's in their app, so they could do it. They could go to a doctor and show it. We don't have yet a system that would automatically sync with the healthcare systems. That will hopefully come down the road.
Now, to describe for us the user experience here. So are they designed to be worn for a certain number of minutes or hours per day? And they're also used for conversations and music and such as well?
That's a great question. For us, number one was to build on existing behaviors that people have. So for example, we do wear earbuds. We're not wearing them 24 hours. We do wear earbuds to listen to music, to be on the call, to be at the meeting. So when you do that, when you put your earbuds for those specific use cases, the system starts collecting the data. And based on those collected data is building the baseline of how actually our heart is responding. So we can interpret which physiological state you are in. So are you going to a fight and flight or rest and digest? Because each person is different. So as you're wearing your earbuds, you're going about your day as you do, the system is collecting the information. But at the same time, whenever you wear your earbuds because you are at the meeting, you can open MindMics app and observe, because we have a simple widget that it's working as a dashboard, so you can observe how your body is responding in real time. And we have a simple widget that shows if you go into the fight and flight or resist digest. From the experience, I can tell you that you can even see those changes depending on who is speaking. And you can start, because it's responding so fast, within 20, 30 seconds, you can start seeing how your body is responding to specific people, because it's because the system is fast enough, so you can start actually seeing what's good, what's bad, and it's fascinating. So basically, as you're wearing your earbuds to go about your day, you can have on the screen that widget that shows you how your body is truly responding. But then, if let's say the system is if you when you see that okay, you're getting a little bit too much toward the fight and flight, you can use one of our breathwork breathing exercises. And actually, some of them are already with music composed by an incredible composer, David Ibet, and they guide you through inhale and exhale. We have a few set of different breathing exercises. We focus a lot on the resonant breathing. That basically it's a slower rate of breathing, and we guide our users. You can open the app, you can click on one of the breathwork exercises, and the app will guide you for the inhale and exhale, and you can see in real time how the heart is responding, how it goes up with the inhale and goes up down with the exhale, and that shows you that yeah, we do have an impact on how on this agility of our cardiac system. So you can actually see those patterns appearing as you inhale and exhale. And on top of that, you can see the heart rate, and you can also see this metric, heart variability. And you can actually start using different exercises to see which one works best, which one will lower the heart rate best, and which one will improve the HRV, because each person is different. So we're providing those tools so you can learn we can guide in how we can easily improve our health in a very short time scale when we need it. So you can just you have it 2 minutes before the meeting. You can take a different breath work that actually could put you a little bit more toward the fight and flight. Because, for example, to learn, to focus, to give a good presentation, we want to be in that state, because this is where you have the adrenaline. This is where there's a lot of goodies happening with that. There is a reason why people go and to do bungee jumping and do a lot of crazy things. It's not because there is a lot of good things when we're getting toward the fight and flight, and it's important state for the performance. Maybe not this extreme fight and flight that we get to. You don't want to stay there for a long time, but that state, that alert state, which is between the equilibrium and fight and flight. So there are breathwork exercises, like box breathing, that can help people to get there. Of course, the optimal state is the equilibrium, where both systems are balanced. So this is a little bit about the experience, but in principle, you're going about your day. And if you have the meeting, if you're watching something, if you're using your earbuds, you can also open MindMics app and look at our widget that shows you in real time how your body is responding. And you can learn very quickly what kind of music helps you to relax quickly, what kind of movies help you to relax, and which way don't. It's to me and other people that we're using the system, it was an incredible journey of discovery of what's good for us and what isn't.
Just terrific. So this is available on iOS, and the MindMics, the earbuds. Tell us about pricing, how it works, and there's obviously a subscription involved as well.
Yes, today at MindMics we have a membership option that includes within the membership option, our customers can get 12 months of the subscription to our app, to our heart health system. And also the membership includes our infrasound earbuds that everybody can use to collect the biosignals all the heartbeats that the ear is broadcasting, but also those earbuds can be used to listen to music, to be on the call. So they also have those other functions that the typical earbuds have. So within the membership 360 today, this includes earbuds as well as access to our app and data that is being stored. We also for us, the privacy is very important as well. So all of that is within that membership. But also we launched the app to the App Store where people can go ahead and if, for example, they are already using devices like Polar Strap. Today we're supporting the Polar Strap, the ECG device. They can just subscribe to our app. There is also option of 7 days free to try the system. And for $12.99 per month, they can if they already have the Polar Strap, they can connect and enjoy the whole biofeedback system and all of the features of the app. And in the future, we're working with a few with earbud brands as well to enable MindMics technology inside them, and we hope that soon people will be able to connect to our app with any earbud with MindMics inside them enabled to enjoy all the features of our app.
That's interesting. So you're partnering with others to bring your technology to some other companies as well.
Yes.
So tell us, are you planning also to bring your app to Android as well, or is that a complicated process?
Oh, we would love to. It's just we are a startup, so we always have to make tough decisions about what we can do, what we should be doing first, and what has to wait until we generate a little bit more revenue. So we would love to also have our app on the Android. It's just a matter of time.
And we should
So
mention that besides the clinical trials that you mentioned before, the trials that you have verifying all of the capabilities here, you've also had backing from the AARP Innovation Labs people as well, which is terrific news.
indeed, we are very excited to be a part of the HTech, one of the portfolio companies, and have such incredible support from the AARP. And yes, we've been conducting multiple clinical studies, the feasibility studies, to understand what this technology can do. And we use that to support our IP portfolio, our patent portfolio, and also to validate all of the metrics that we launching that are part of our current product. And then now we're working on the next metrics that will help us improve our health.
And as things roll along here, will the existing hardware work with the updates that you have planned with the capabilities?
That's what's really incredible about this technology, that once we enable MindMics inside, then the new applications will only require software updates. But of course, I hope there will be a lot of improvements in terms of the quality of microphones, that those earbuds with time will allow us to do much, much more. But within the next few quarters, any new feature that will be launched should work on the earbuds on the same earbuds. So that's quite exciting.
Terrific. For more information, where can people go?
For more information, people can go to mindmics.com, to our website. We also have a series of blogs where you can read about the technology itself, as well as the physiology and how the breath work can be used. We also have a few exciting, very interesting blogs about heart itself.
Terrific. It's mindmics.com, MindMics.com. Anna Barnacka, thank you so much for spending time with us.
Thank you so much. That was my pleasure.